Hello, my friends. This is Dr. Diana as patient, and I am pretty ill. Now, as many of you know, I've been honored to speak in front of some wonderfully impressive and prestigious groups. Now, though I posted my PowerPoints here on this site, honestly, I don't think anyone can find them, and I had trouble finding them. And without the audio, who really wants to look at a bunch of PowerPoint slides? Not me. So, first, I'd like to share with you my presentation at the second annual CCSVI Symposium that took place July 15th through 17th in New York. Dr. Sal Scafani put on the symposium together with doctors from all around the world who both attended and spoke. It was wonderful. Dr. Scafani asked me to speak because he saw my clinical trial about looking for signs of CCSVI in the fundus, that is the back of the eye. Now, I don't know if they were prepared for what else I threw at them. No, I got an incredible response, and I've continued to contact with many doctors from around the world. Who doesn't love Skype, I ask you, but I digress. My presentation is here, and Dr. Scafani told me, no jokes. Okay, that was really, really hard for me, but here you go. Hope you enjoy. Hi, thank you, Dr. Scafani. Yes, I'm Diana Driscoll. I have my financial disclosure statement there. And you may know me as Dr. Diana as patient, and I am pretty ill. I am so excited to be here and speak in front of such a prestigious crowd. Thank you so much for having me. And I think in order to get my foot in the door here, I had to have a gimmick, right? So what is my gimmick? One, I have ehlers-danlos syndrome, which is a defect in my collagen. It results in loose joints, but it also results in fragile and leaky vessels, permeable blood-brain barrier. Basically, I am more prone to developing multiple sclerosis, as are my other EDS brethren. So I have autonomic dysfunction, or what we call POTS, postural orthostatic tachycardia syndrome. I have mast cell disease. I have CCSVI and have been treated with angioplasty. Those are what my wonderful husband would call lovingly my jugs. I have one brain lesion, and I was developing symptoms of multiple sclerosis. Now, many people didn't realize there is an overlap between Ehlers-Danlos syndrome and multiple sclerosis. More people with Ehlers-Danlos do go on to develop multiple sclerosis than in the general population, but there is also a 10 to 11 times increased prevalence of Ehlers-Danlos in MS patients. And every time I go to a conference, say for example something like this CCSVI conference, I'll meet a great number of MS patients. I will find one or two that have Ehlers-Danlos that's undiagnosed. When I go to an Ehlers-Danlos conference, I meet quite a few people who have multiple sclerosis. I kind of, with my angioplasty, was trying to figure out what was causing this backup, if you will, of blood. Why all of a sudden had my weak vessels suddenly become less effective? So then I was thinking, being the eye doctor, a therapeutic optometrist on a professional disability, by the way, but thinking, could this backup in my internal jugulars go all the way up to the back of the eye, the fundus of the eye, and actually show up by looking very closely at the fundus of the eye? And I did as what most very good scientists do who are affected by the disease, and that is I grabbed my own images first and took a look. And first everything looked okay, but I just kept magnifying it, and boom, there it was. So I started a clinical trial looking for evidence of CCSVI in the fundus of the eye. This is a normal fundus. Very briefly, what we're looking at here, of course, you see the optic nerve and the macula there in the middle. But looking at the vessels, the veins are the larger, darker ones. The arteries are the smaller ones. What we want to see is an AV ratio, artery to vein ratio, of approximately 2 to 3. And this is a normal fundus, and that is indeed what we see. I also wanted to make sure I reviewed my anatomy. Does the internal jugular indeed do the veins go all the way up into the back of the fundus? Yes, indeed they do. They start at the capillaries of the retina, go on through cavernous sinus, as you see here, down into the internal jugular vein. That was important to know. It was amazing how difficult it was to find this information because the arteries seem to get all of the attention, as you know. This is my image, my fundus image that I first pulled up. And again, in a backed up view, it looked perfectly normal. But if you can tell, let's look on the left, that dark vein there, that looks too big. And the artery right next to it looks a little too small. Basically, the AV ratio does not look right. Now, if you look on the right-hand side, that is my right eye, indeed, that vein looks not only too large, but it looks beaded. Very similar, if you will, to what we see in CCSVI with a vein that is not draining properly. And the difference in the AV ratio in that eye, indeed, hints at poor venous drainage in that eye. This is another one. Whoa, that's very dark. I hope you can see that. This is another patient with ehlers-danlos and multiple sclerosis, and indeed you can see the same presentation in those large veins that do not appear to be draining properly. You can see some evidence of stenosis there on the left-hand side at about 7 o'clock and at about, what would that be, 3:30? So, and the same picture is on the right-hand side, but again showing this larger size vein. One other patient I looked at was very disabled, and I pulled back on this image to show you what really grabbed me. Try to ignore that large vitreous floater, although that is impressive right there in the middle. I looked at her image and thought, holy cow, where are the vessels? We do see the choroidal vessels under the retina, and those look okay. But looking on top of the retina, if you will, at the arteries and veins, they almost aren't even there. And I thought, if this is the perfusion that's getting to the back of the eye, what kind of perfusion is getting into her brain? And also the size of those arteries are so small, I asked myself, is this a stroke waiting to happen? Finally, what it made me think of is the patients that CCSVI is performed upon, and that on the table, these patients say immediately they feel like they have super X-ray power vision. It's like it went to high def, if you will. Were we indeed increasing the perfusion of the retina? And my guess is yes, but I'd love to see some images when that happens. The other thought I had is if the blood is backing up and we can see that it's not draining well from the fundus of the eye, it must back up and cause some pressure inside the cavernous sinus. And the cavernous sinus is unusual in that it is bordered on one side by a temporal bone, the other side by the sphenoidal sinus bone. And it has 5 cranial nerves running through it, as you can see here. It also has the internal carotid artery. Now, if the venous pressure is building up because of poor drainage, it's not going to harm the internal carotid artery. The pressure is just too high there. But those cranial nerves are delicate, and if the venous pressure is high, putting pressure on those delicate cranial nerves, I could understand that we could see some intermittent, perhaps, subtle symptoms that are affected by the pressure on these nerves, and probably ischemia of the nerves. And these symptoms would likely wax and wane. 3 of these cranial nerves involve eye movement. So perhaps we would see some intermittent double vision, or say looking to the side using our lateral rectus, cranial nerve 6. We would see double vision or almost double vision there. I myself experience fighting double vision and had an episode, or a few episodes, where I would look to the side, say at my car radio, and looked as if it was moving away from me. And I knew that was a partial paralysis of the lateral rectus muscle, because it changed the depth perception. So that's just kind of the geekiness of having a bizarre symptom, being able to figure that out. So I would like us to look at some of the potential symptoms these patients have and see if indeed they are indicative of increased pressure in the cavernous sinus. Also, those other two nerves could cause increase in deep facial pain and sinus pain where there is no sinus infection. And I myself have experienced both. And it is not subtle, my friends. It was severe and yet intermittent. So it relates back to what we would consider, say, a low-level cavernous sinus thrombosis, if you will, which can cause a venous stasis retinopathy. Things aren't moving. The blood on the fundus is stagnant, and that can cause this sort of presentation. So there's a great article there mentioned.